So we want to welcome all of our business partners. Oh my God, I am so excited. I just wish I was there with you. But this is going to be an amazing webinar. You still have time as we are doing our introduction to get your folks on the line because they do not want to miss this. So we have tonight Cassandra Keys, AKA Sandy Rose, and you see her there. Are you spotlighted? We're going to spotlight that video and make sure. She's a licensed massage therapist for over 8 years. This woman took the big leap to become a full-time entrepreneur a little over 2 years ago. She came on board and locked arms with us here at Wakanna in August of 2020 with Minister Mooney. So she's one of Minister Mooney's downline. So you're like my cousin, right? Because Minister Mooney, let's see, Minister Mooney's my little brother. So you're my cousin. There you go. She established in 2009 Replenish Spa, which is located at 124 South Washington Avenue. She's located in downtown Ohio. It's a Black-owned spa. It's owned by a mom and 2 sisters. So again, we've got that Black girl magic going on.
Yeah.
Cassandra Keys is the principal educator of bodywork and massage. So let's all welcome Cassandra Keys, AKA Sandy Rose.
Yay. Thank you so much, Dr. Rita, for having me tonight and the Wakanna Nation. I am really honored to be here. I am super excited to share with you guys this demonstration. I'm going to bring over my partner in crime tonight, Mr. Jaquan. Come on over here. He's actually going to be on the table with us tonight. He's also going to share his experience.
Good evening.
You're so lucky. I need a massage.
He's also going to share his experience with my massage techniques as well as the CBD massage. But first, before we do that, I'm just going to educate everybody just a little bit about CBD massage and what we do.
Wonderful. You want to stop your video so we can just see the slides?
Yes, ma'am.
Wonderful.
All right, perfect. So as I mentioned, CBD and massage is what we're going to be talking about tonight. You can see this wonderful back view because most of the time when people come in to see me, they get to touching their shoulders and their back and they say something like, it hurts up in here. And I will describe a little bit about the specific muscles that we'll be working with tonight a little later. All right, so some of the key benefits of massage therapy, which we all know, are relaxation, chronic pain management, muscle tension, or as you know it, tightness, anxiety, arthritis, and much more. And before I move on, I just want to say, especially during these times, I want everybody to remember to take care of yourself. Self-care is so important. Again, especially during these times, it's just as important as your job and your other responsibilities. So please take time out to take care of yourselves. All right, so massage, CBD, and how it affects the endocannabinoid system. Anandamide, which is an endocannabinoid, is a fatty acid neurotransmitter produced by the body and is responsible for the feelings of joy, delight, and bliss. And it's actually found in a bunch of other things, which is why we are so happy after drinking wine, eating chocolate, and after getting a massage. So the endocannabinoid system is a biological system composed of endocannabinoids, which bind to cannabinoid receptors. Cannabinoid receptors are located throughout the entire body and are involved in physiological processes like your pain sensation, relaxation, mood, etc. Okay, and what are cannabinoids? There are many cannabinoids, but the 2 that we are most concerned with here at Wakanna and with CBD are the cannabidiol, which is CBD, and tetrahydrocannabinol, which is THC. And just in case you guys don't know, the THC is kind of what gives you the term, the high feeling, the more relaxed feeling. And that's kind of one of the ingredients that I use in my massages. And when infused, the CBD and the THC found in the CBD massage cream or oil helps to reduce inflammation and soothes tired and achy muscles. So the CBD helps to reduce the chronic pain and the fatigue, while the THC induces relaxation and aids in sleep. And together, this 1-2 punch has a lasting effect, promoting ultimate relaxation and healing. Tonight, I'm going to be using Wakanna's Extreme Pain Relief. It contains 400 milligrams of CBD and less than 0.3% THC, which Dr. Rita will explain a little more about a little later. And I'm also going to be using some warm towels before the massage. Please keep in mind that you only want to use warm towels before the massage for 2 reasons. Reason number 1, of course, you don't want to wipe the goodness off once you're done. Reason number 2 is because if you put heat on after a massage technique like this, after using CBD, because of what it does, it will give you an adverse effect, making you feel like you have the flu, you'll get chills, and other effects, and it just will not be the same later on. But using warm towels promotes tissue softening and deeper penetration for the treatment. Okay, so I am going to be massaging tonight what I call the big 3, the trapezius muscle, which is the muscle coming down in that nice V shape from the shoulders all the way down past the middle of the back. The rhomboids minor and major, which are located on either side of the spine, and the levator scapulae. And what that one is very important. That's right there on the side of your neck, that little curve. You know, when after a long day, when you get done working, you start rubbing back there, that's where your headache usually occurs. And this is what I call the big 3. And this is what I'll be massaging and demonstrating tonight. All right, Dr. Rita, I'm going to give it over back to you while I get prepared.
Wonderful. So we are going to now, you're going to, can you take your video off so we can see? We don't want to miss a demonstration. Wonderful. So what we need to do is, I think we had the camera a lot better.
We did.
We want to make sure, yep, that we can see your subject. Oh, he's already on the bed. Lucky.
Table.
He's already on the table.
Yes, he's ready. Yes. So I am using, I'm just going to put it here, a combination of shea butter as well as the Extreme Relief. I like to use a combination.
I can't see your head. So can you make that higher?
Yes.
That earlier?
Yes, ma'am.
Wonderful. Okay, can you show us that again? What's in that container? What's in that container?
So I just have equal parts of shea butter along with the Extreme Relief, and I combine the 2 together.
So what type of shea butter? I mean, do you get that from Walgreens or?
No, actually it is a shea butter that we get from somebody else. It is raw shea butter that we put down, that we, you know, make into a cream so that we can use it specifically.
Okay.
So we do it the old-fashioned way.
Okay.
Yes. All right, so I'm going to just get started here. Like I was mentioning, can you guys see my hands pretty well?
We can see your hands very well.
Okay, so like I was mentioning, here's the traps down in the middle. Rhomboids on the side, the levator up in here, in this area. I like to start off by spreading all of my cream in. I save a little bit for the last to put on just a little more. And then just to get the muscles ready, I like to take one long sweep down to the bottom, add in pressure, bring it up. Down and around. So the first part that I am working on are the traps.
So did he get that warm towel already?
I did not do the warm towel.
Okay.
But it should have went first. So
Okay.
thank you for mentioning that. I can't do it now because then I'll have that adverse effect. So spread all around, either side of the traps, on down to the rhomboids. And I'm going to throw in a bonus muscle because Mr. Jaquan boxes, and I'm going to also incorporate the lats, which are right here on the side.
He's a boxer.
He is.
Don't make him mad.
He's a nice guy.
Good.
Okay, so again, just a few more sweeps down. High pressure back up. Down. High pressure back up. And around. And then I like to go on either side.
Okay, people are asking again, which CBD oil did you mix with the shea butter?
What CBD oil did I mix with it?
Yeah.
I used the Extreme 400.
Oh, so you didn't use the oil. You used our Power Extreme
Topical cream. The Extreme
topical cream.
Yes.
Oh.
Yes. You can use oil if you are also going to be using like a grapeseed or an almond oil or something like that. But because of the tackiness of the topical cream, when I'm on a back, I prefer to use that because I can get a deeper traction with it. So go around, again, the rhomboids, making sure that I cover all areas, down towards the ribs or the lats, in this area here. And then I will do the opposite side. And leaving for last, I do those levators. Levators go into an angle. And I usually add more pressure in there because that's where all the trigger points are, or what everybody knows as knots. All right, a few more sweeps. Going down, and I usually do this for about 15 or 20 minutes. Again, making sure that I have spreaded the cream and the CBD across the entire back.
So how much Power Extreme did you use? Would you say, is it a teaspoon, a tablespoon? If you could put a measurement to it.
If I can put a measurement to it, I'll say I used half a teaspoon.
Wow.
And I use half a teaspoon. I'm sorry?
Not a lot at all.
Not a lot at all, because a little goes a long way, especially when I infuse it with the shea butter. I use equal parts of both. And I save some for last, and I would usually just spread it over lightly towards the end for a lasting effect. Get right up under the lats and pull.
Yes.
And that's usually how.
Everybody wants to hear from the gentleman. We will be hearing a testimony from the gentleman. Yes.
You will be hearing a testimony from the gentleman here in just a second.
As long as he doesn't box us, right?
Right. I'll stop sharing my screen so that he can get up and get ready for that testimony. And we'll go from there.
Yes, because there may be children on the line.
Exactly.
Wonderful. Everybody's saying no, share the picture. So while they are getting set up for that, just want to let you know that this is the product that Sandy Rose is using. It's our Power Pain Relief Cream. It's 400 milligrams of CBD in a 30 ml jar. It's a 1 ounce jar, right? But what's so amazing about this product is this product has 15 ingredients. 15 ingredients. What are the other ingredients? Well, in here is MCT coconut oil, shea butter, menthol, cinnamon, clove, orange, eucalyptus, arnica, sweet basil, spearmint, peppermint,
And you
turmeric,
do have the CBD
arnica,
on you, so be ready to get
and of course, the cannabis sativa. So what we love about this product is that when you use a topical product, you understand that topical products offer local relief. And because this is our power product, that's a product that contains 0.3% of THC. You can actually use this product if you are undergoing random drug screens. Why? Because topical products do not pass the blood-brain barrier. So a topical product can be used safely without interrupting or causing your drug screen to be positive. I also like this product because you only need a little bit. Like Sandy Rose said, a little goes a long way. More is not better when we're talking about CBD. This is a product, again, that I use every single day. Why? Because I work out every single day. You know, my chiropractor friends, I have a lot of friends that are chiropractors. They say that 75% of their patients come to see them because of back pain, because of lower back pain. And many of them are seniors. You know, as we age, we get something called degenerative joint disease or osteoarthritis. And then on the other hand, they have young people like this gentleman, right? They may have a sports injury or they may have an injury due to overuse, but the younger generation needs this product as well. And then remember, we always say, if you have chronic long-term pain that has not been diagnosed, maybe you don't know why your back hurts and it's severe and you have other symptoms, systemic symptoms like fever, you really need that to be checked out, right? You have to make sure that there's no underlying disease like cancer of the spine or something very, very serious like infection of the spine. So always consult your physician if you have unresolved back pain along with other symptoms with fever, etc. That could be a sign of something more serious. Otherwise, this is an amazing product that can be used to offer local relief in areas that hurt anywhere. It doesn't have to be your back. It can be your head. I've had headaches where I've taken a little bit of our Power Extreme topical and rubbed it in the temporal area. So we're going to see if our boxer is ready to give his testimony, because you don't want to hear Dr. Rita's.
I can't hear you, Dr. Rita.
All right, we want to have you share your story on how this product has worked for you.
All right, well, good evening, everyone. My name is Jaquan. Getting into CBD massage, I think for me has been, I've been seeing Cassandra now for some time and getting regular massages for just for sports related activities. I'm always sore from training and I work in a stressful environment. So she's really helped me a lot in not only me pay more attention to where I'm stressed, but being more mindful of as I move through my days of navigating stress better. When I didn't think that could get any better, I think incorporating the CBD has really what I noticed more up front was the tension in my muscles. I noticed it was different. It was like a deeper massage. Even the area she just did on my back, I can notice. I can't really explain it like I know when I wake up in the morning, I'm going to feel. It helps me recover faster. That's what I noticed. I feel like less sore for a shorter period of time. So yeah, it's been highly effective so far, and I do intend to keep using CBD massages as a part of my treatment as I continue, to work more and work out more.
Perfect.
Yeah.
Wow, that's a powerful share. And why it's so powerful, because I don't know what you did in the past, but I know what I have done in the past when I have sore muscles. And what I used to do in the past was take Motrin or Aleve. And we know now, when we look at the research, that long-term use of Motrin and Aleve, or even acetaminophen, maybe Tylenol is what you would take. Long-term use of those over-the-counter medications cause kidney failure. We see increase in people getting dialysis just from a medication that you could take every day because you have sore muscles due to sports or due to an injury. So this is absolutely a great alternative for those who want local relief, for those who do not want to continue to take medications that can cause organ failure long term. So thank you for that share. Thank you for that demonstration, Sandra. We are going to talk about, again, the benefits of CBD. The benefits of CBD is that CBD is an anti-inflammatory. CBD is an analgesic. CBD also offers what he talked about. The recovery of your muscles don't take as long as before. So it shortens the recovery time if you're working out, if you're boxing. And even we see that giving local relief to areas can cause the stress to be reduced. I mean, when you're in pain, that's a anxiety provoking thing that occurs. So just reducing pain reduces anxiety and stress. So beneficial, you don't need a lot. This is our 400 milligram power relief cream. It's an amazing product. Why? Because there are 15 ingredients in this jar. We have a proprietary formula where we understand essential oils address inflammation. Essential oils reduce inflammation. Turmeric, just take turmeric alone and how powerful turmeric is. When you add that with the peppermint and spearmint and arnica and black seed and clove and cinnamon and eucalyptus and sweet basil, hands down an amazing product in one jar. You just need a little, take a little fingertip and massage it wherever you have dis-ease. And again, you want to really concentrate and rub it real deep so that it can really take effect in those deep muscles as well as superficial. So as the boxer, would he prefer the CBD massage versus without the CBD? So Sandra, we want to know if the boxer would prefer a massage with CBD or without CBD. That's the question. Put your questions in the chat box too.
So to answer that question, so far, he would prefer with the CBD because of the deeper penetration. Again, and this is for all athletes, especially for myself, and this is why I started using CBD too, is it just helps you recover much faster. It gets rid of the inflammation out of your muscles. And for me specifically, having a recent injury, it just helps that healing process. So for him, he uses the CBD massage right after the next day after boxing. Because you're tearing, having little micro tears in your muscle, and as you're pushing that inflammation out, the quicker those muscles will repair and grow. So yes, he uses it better.
Wonderful. So there were some questions about fibromyalgia, arthritis, and lupus. Because CBD is an anti-inflammatory, absolutely, this product can be used in any condition that has inflammation. And we know those conditions, especially arthritis, be it osteoarthritis or rheumatoid arthritis, all of the itises have inflammation. Sciatica, that's another issue with a lot of folks and why they seek massages and chiropractic manipulation. Lupus as well. all of those conditions can cause joint inflammation and pain and muscle pain as well. So that's a really good question. Yes, this is a phenomenal product. Massage works wonders for my spasticity. This is Erica Zachary, who has multiple sclerosis. She says, due to my MS, she likes to use it for the legs, her upper back, and because it reduces pain, like I said, anxiety is reduced. So she loves the product as well. Darren says, I have a client that is pregnant and she wanted to know if the Relief Topical CBD would be used during her labor and delivery process. You know, we actually have a business partner whose daughter used our topical CBD product because the anesthesiologist was taking too long to give her her epidural. So it is to the discretion of this client to use the topical for relief. Absolutely. I know I would use it in my labor and delivery unit, but unfortunately your client is not my doctor, and unfortunately we can't make any claims, but what we can say is absolutely she should give it a try. If there's any other questions or comments from our medical advisory board, please unmute yourself, as well as maybe give your testimony. And if there's any questions from our attendees, please just put it in the chat box. We want to have a really engaging talk this evening about topical relief from our Power Pain Cream.
Dr. Rita?
Yes.
Hi. So I did put in the chat, but Sunday I actually had my first CBD massage, and I invited the massage therapist. I believe she's on the call. Her name is Kim.
Hi,
and
Kim.
Are you there, Kim? So I wanted to say that, you know, with having lupus, with having a few weeks ago, we had a chiropractor on the call, and I had sustained a neck injury in an automobile accident. Besides all that, I was already using the CBD, but this was my first massage, and I felt very good afterwards. My problem has been not stretching properly before exercise and walking, and I've been doing like 6 to 8 miles, 5 days a week. And I just got away from the basics of stretching, so my muscles were very, well, still are, but she was able to work through a little bit. Still has some more work to go, but I think the CBD made a big, huge difference for me with my pain, with my comfort level, and just the way I recover. I put it on my ankles, my knees, and my hips before I do my walk. You know what I mean? I'm carrying extra weight. So I worry about that pain from that, plus the degenerative changes. I just turned 50 this year, that on top of having the lupus. So the topical ointment that I use has been great for that.
Wow, that's a powerful share. And what I love about the time that we're in is that now a lot of massage therapists are coming to you. So absolutely, it's a great way to introduce massage therapists during your service with your product. Someone else on the chat just said that they did a massage on one of their clients. This is Diane Brown. She did a massage on one of her clients and her muscle pain was deep. The products helped her to sleep much better. And what Diane Brown used, Sandra, was she used the topical relief. The 200 milligram is now our 400 milligram. And she used the Dr. Rita's rub. She put the oil first, and then she used the cream on top. She used both, and I've combined both. Oh my goodness, I've combined both. Thank you, Diane, for reminding me. And she combined both because this particular client had back surgery, and the client was very happy. So thank you for that share so much. Ernestine, are there any massage therapists in Chicago who use our products? If you're a massage therapist in Chicago and you use our products, please put it in the chat. But if there are no massage therapists in Chicago, then I think that we need to get busy, all of us, and introduce them to our product. Another person says, my son used the Relief 200 milligrams, which is now the 400 milligrams with the pre-roll and the tincture and got great, great relief. I've been using CBD massages for over a year and my clients love it. That's Marguerite Wright. Oh, Marguerite Wright, awesome. Sandy Rose, this is a question for you. Oh, Sandy Rose is my aunt. So Jim Blount is on. She introduced me to the products. I have a soft tissue injury in my left ankle. I definitely noticed the difference when I use it. Now I use it every day after work. Awesome. I'm not sure what someone is asking. Someone's trying to ask about an autoimmune disease or autoimmune illness. And autoimmune conditions are multiple sclerosis, lupus, rheumatoid arthritis. There are studies and data that show that CBD, as it being a powerful anti-inflammatory, has been effective in those studies with autoimmune conditions. And LaShawn is a testimony by that as well, because LaShawn has lupus as well. Are there any CBD products can reduce a thick left ventricle? A thick left ventricle? I'm not sure if you're talking about a thick left ventricle of the heart, but let me know if that's what you're talking about. Anyone from the Medical Advisory Board want to add anything as we're waiting for questions?
Hi, good evening, everyone. This is Dr. Gettings. I joined late, but I just wanted to say I too work out just about every day. I'm a runner, and I find that whether it be sometimes lower back pain, I'm getting better with picking out better shoes, or either some knee pain. The topicals work great. So I know there's a lot of conversation about like treating things, but I also feel just in terms of being proactive and prevention in terms of just decreasing inflammation just from regular use and working out is just something else to take into consideration when it comes to preserving our joints. So that's my share.
Yes. And it's much better when you live in Chicago and you do all that running than running in Florida. But thank you for that share. It's just so important. You know, we talk about, you know, the marriage of a good diet, of, you know, drinking your water, getting proper rest, stretching before you're working out, you know, having proper shoes when you're running, all of these things. And when you combine it with CBD, it's just such an amazing result that you see. You know, when I look at patients and they have chronic illnesses, like all of us physicians that are on the line, the number one thing that we talk about is an anti-inflammatory diet, right? It does not help to have a diet full of fried food and processed food and think that CBD is going to be as effective as it really could. So making sure that your diet is clean, making sure that, you know, you are using the proper equipment. If you're running, if you're doing any sort of exercising, it really makes a difference. Even when you're at work, proper posture. I do know that Dr. Gettings, you got that device so that you're not sitting, so that you're up and walking, you know, all of
that's a walking workstation. I don't know if you all can see it.
Yes.
In the office, but that's what I use to keep from sitting all day and making my joints stiff. I've read an article that says sitting is the new smoking. So I try to keep it moving. But yeah, love the walking workstation.
Wonderful. Awesome. Any other comments from our medical advisory board? We do have questions in the chat that I'm not going to address if they're not pertaining to our topic tonight, because we don't want to get off talking about glaucoma and other things. Let's kind of concentrate on how we can really share this amazing product, our topical products, with our family, with our friends, so we can help them decrease the use of Motrin and Aleve and ibuprofen and all of those non-steroidal anti-inflammatory drugs that can cause long-term kidney failure. So we can really talk to them about how CBD used topically can be very effective when you're getting a massage. And you may not have a Sandy Rose, so you have to do a self-massage, right, Sandy? Can you tell us or show us how we can do this ourselves if we don't have you around or any other massage therapists?
Absolutely. So of course that trapped area that I was massaging on may be a little tough, but I'll show you how I use it for myself, because like I mentioned recently, I just had a knee injury. I injured my meniscus, if you can see it a little well, and I take the cream, and I use quite a bit of it because I just love the way that it feels. It gets warm, but after I ice my knee, then I'm gonna step back just a little bit.
Please be careful.
The meniscus up in here, this area, but I'll take the cream and put it around the entire knee as well as right on top, because it won't do any harm to it. And as you guys can see, I am no longer inflamed, and it's only been 3 days. And just 2 days ago, I was a big cantaloupe. So it has worked wonders for me. With this situation, of course, continue to RICE, which is rest, ice, compression, and elevation, which I use every night. So I ice, and then I put the topical on, and then I put the topical on again in the morning before I leave out for work.
Can you just tell me what your physician said about your knee?
So my physician told me that it was a small, he called it a tiny little tear in my meniscus in the left knee. I was doing lateral lunges at the gym. And and he told me that because my tendons and my ligaments were pretty healthy, I have a healthy leg, a lot of muscle surrounding the knee that, you know, may or may not need surgery. I'll go to an ortho and see. But he did mention, because I work out 5 to 6 days a week, that support from the muscle is what's kind of is what's helping out greatly.
Yeah,
He also,
you got to share with them what he said when you went back.
about the CBD.
Yeah.
Okay, so he asked me what I was doing, because it had only been a couple of days and the inflammation was leaving. And I said, well, I'm icing. Oh, I'm using CBD too. And he said, you know what? The CBD is what's doing it. I handed him my card because I'm like, you need a massage, I can see. But so yeah, he was an advocate for CBD. He asked me about it. We'll be talking about it again. So hopefully I'll have a doctor on my team here soon.
Wonderful, wonderful.
Yes.
So physicians really know very little about CBD, but what I thought was so powerful was that CBD, after a couple of days, even her physician noticed a reduction in the inflammation and the swelling, just from CBD and the other natural remedies that we can use to address our health and our wellness. Wonderful. Any other, there's a question about transdermal CBD. Yes, that is absolutely in the horizon. We are looking at transdermal patches, CBD patches, so just stay tuned to that. We're looking at so many amazing new products here at Wakanna, and so stay tuned for that. But for now, we have 3 topical products. We have 2 pain relief creams and 1 liquid formulation. Some people combine them like I do sometimes. Some people use them separately. What's the difference between all 3? Well, the difference is one has 15 ingredients. That is our 400 milligram. Our 500 milligram has 8 ingredients, and our Dr. Rita's Rub has 20 ingredients. So with all of the ingredients, we use all organic, USDA certified essential oils. All of our products are tested. All of our products contain a certificate of analysis, and it's really on the discretion of you. If you like cream better, if you like a liquid form better, but those are our 3 amazing products that you can use topically without it causing a positive urine drug screen. Any other questions? We're going to be wrapping it up soon. Someone, I have really bad insomnia and given prescription for sleep aids. Nothing worked, nothing worked. I don't know.
I think she means gummy.
Oh, she took half a gummy and slept for the whole night. Yes, we have amazing gummies. We just have amazing products. So absolutely, whoever invited you on the call, you want to make sure that you contact the person who invited you. So not only you can get our topical products, but you can hear much more about all of the products that we offer here at Wakanna. Any other comments?
Dr. Rita, can I make a suggestion? I see in the chat people asking about taking their own CBD to the massage, to their massage therapist, and I absolutely recommend that because they may have a product that you're not familiar with, but you already know from using Wakanna CBD the benefits. So I would say take your own product and ask them to use that in your massage. Secondly, I have a question. With the weather turning cooler soon in the next month or so, what recommendations would you make as a massage therapist or physician regarding preventive measures for the changes in the level of pain that will become with the cold weather?
Great question.
Like from arthritis, osteodegenerative joint changes, things like that. So how can we prepare ourselves for that anticipation?
Yes. What I do, and I'll go first, what I do is that I anticipate that. And what I do before I work out, LaShawn, I use the product in the areas that give me issues. It's my left shoulder, my right knee, and my lower back. So those areas, they get this cream every single night. So when I'm asleep, I'm getting the benefits of CBD as I'm sleeping. And before I work out, I do the same exact thing. And I think with the weather changing, when people know that their arthritis, that dis-ease becomes worse when it rains or it's very wet outside or cold, they absolutely can get ahead of the game, get ahead of the inflammation and pain. And what we do is use it before that pain becomes very debilitating. So I don't like to use the word pre-medicate because the FDA doesn't like us to use words that are associated with medication. So what I do is I do a preventive usage of my cream, and I use it at night when I'm asleep, and I use it before every workout. So that's what I do. Amazing results.
Okay,
Great question. That's a great question. Sandra, do you want to add anything?
Yes, being in Ohio, sometimes it gets very cold in the morning and then it heats up 20, 30 degrees in the afternoon and evening, and that causes inflammation, and it causes just other things to go on with your joints and with your muscles. And just like you said, Dr. Rita, I use it before I head out of the door, just to kind of get ahead of the game. But what I usually tell my clients is get on a regimen. Your body will thank you. You don't want to use it today or come in for a massage and get a treatment today and then call and maybe get in 5 weeks from now. You want to talk to your therapist if you are getting a massage and getting a treatment like this. Get on bi-weekly, every 3 weeks, every 4 weeks, right on the books so that you know that you're going in for this treatment, and it can actually, again, start to prevent these things from happening because now you're on a certain regimen.
Okay.
So I just usually tell everybody to just get in on a great schedule. And to also mention, like LaShawn said, once you take your CBD in with you to your therapist, then start asking your therapist to go ahead and carry it for you and for everybody else.
That's
right?
right.
Yes.
I'd like
I
to
had that
share.
conversation Sunday with my therapist. She's on the line. We talked about the Wakanna product line, so I think she's a little shy about asking questions. But Kim, you can ask your questions about the product.
Kim, don't be shy.
I saw a question from Eunice Summers, who I invited. She also is a massage therapist. She had a question about the ultrasound therapy, and I'm trying to see if I can go back up to see the whole question. But if it could be used with infrared and ultrasound therapy.
Sandy Rose, do you know if it's okay to use this product with red light therapy or near far infrared sauna or ultrasound therapy?
So I will have to say that I am not familiar with that. And depending on how that penetrates into the body, I don't know if it would have the same effect that like that warm towel that I was talking about would have, heat on top of heat. So I don't know how that would affect the body at all. So you may have to do just a little more research, and I can too. Honestly, I can do a little more research on the infrared. I've used it before for other injuries, so I know exactly what it is. But if I can get back to you, if I can find out who it is and get back to you and do a little research on it, we can definitely dig deeper and find out how that may affect if we combine the two.
Sounds great. We'll do the research, Eunice, and we'll get back to you.
Yeah.
Meridian wants to know, what treatment do you recommend for treating arthritic knees?
Ooh.
I can answer that.
Okay. Crawford,
Yes.
thank you.
Yes, as far as the arthritis, you want to make sure that you're getting some activity in. So depending on what joint it is, you still kind of want to move it around, stretch the muscles, because you have to remember you have the joint, the bones, and the muscle and the ligaments. So those can be two separate pains. So in addition to one of the 3 topical creams we mentioned, you can also do the hemprenium tincture twice a day and gummies at night, because as Sandra mentioned, you want to have something consistent in your body because arthritis is chronic.
Yeah. Thank you so much, Dr. Crawford. Thank you, Meridian. That was a great question. You know, everything again points to our diets, making sure that we're stretching, making sure that we're active, and getting on a regimen. I just love that, Sandy. Getting on a regimen. I have a regimen. When I go to sleep, I put my pain cream on. Before my workouts, I put my pain cream on. That is a regimen that I do not stop. You know, I was telling Sandy, I tore my ACL, MCL, and meniscus in 2009. Never had surgery, went through physical therapy. But I'm telling you, I've not taken Motrin, Aleve, Tylenol, or any pain medication since I was introduced in 2017 to CBD. And I'm just so grateful because, again, long-term use of even those benign over-the-counter medications can cause long-term kidney and liver failure. So absolutely, CBD is a godsend. Again, topical products that are our power products do not pass the blood-brain barrier. So if you have random drug screens at your place of work, you can use these safely without worrying about that. So that's really, really important. Wonderful. So if there's any other comments.
So I would like to share.
Yes, Dr. Betty, please.
Yes. So I am a naturopath. I'm not a massage therapist. So after I do my manipulation, if anyone doesn't know, naprapathy is very similar to chiropractic. However, it does focus more on the connective tissues and it's very gentle. So after I do my treatment, then I will use the topical products to just glaze over the areas of concern. And I also recommend that my clients utilize that topical ointment as well as the hempranium, because as we all know, inflammation is generally systemic and contributes greatly to the pain, especially in joints as well as the musculature. So you want to attack it from the inside and the outside. And then the other thing is to, again, remind people to drink plenty of water, because most people don't drink enough water, and you need to hydrate your body and help those tissues to remain pliable and resilient. In regard to the question about utilizing the topical ointment in conjunction with things like infrared and that kind of thing, just from experience, you should never use a cream or an ointment at the same time. You should actually have clean skin. It's even recommended not to use any lotion prior to things like laser, infrared, and that kind of thing, because you don't want to burn the client, number one. And number two, with our products, we have, excuse me, our topicals have some oils in there that are very hot. So you definitely don't want to add heat on top of that product. And yeah, and so yesterday, or day before yesterday, I fell up the stairs on the porch and slid across the porch on my right hip. And that was about all with my hand and my hip. And oh boy, did I see stars. And of course, I immediately ran for my Dr. Rita's rub, first of all. And then I put the extreme pain, extreme relief on top of it. And I got a bruise, but I tell you, that bruise is dissipating as we speak, and it's just been like 2 days. And my husband keeps saying, well, you want this patch the acupuncturist gave? I'm like, no, I'm good. I'm good. And I mean, I barely feel it at all, but I'm telling you, ooh, that's smart.
Wow.
So the cream, and then one other just little bitty thing, I stubbed my toe, my big toe, and you know what that feels like. That makes you see stars. I ran and got my extreme relief, and I took not even a nail full, and I just put it on my big toe, and that pain was gone within 2 minutes, and I never felt it again. So these products work.
Powerful share. Powerful share. I'm so glad you're fine, Dr. Betty. You got to be careful. Thank you for answering Eunice's question. That makes a lot of sense, right? That you don't want to use any sort of lotion or oils when you're doing laser or infrared or ultrasound sort of procedure. So thank you for that information. And then remembering that you need to address the inflammation from within as well. So we have an amazing tincture here at Wakanna. We have a product for those who have random drug screens. We have our pure products, our power products if you don't. So just combine all of those amazing products so that inflammation can be addressed. Now there's a question about doesn't show up on your drug screen. Whenever you use a topical product that has the legal limit of THC in it, which is 0.3%, this product doesn't get into the bloodstream, which can then eventually show up in your urine. So that's what we mean when we say it doesn't show up on a drug screen. That means that the THC, the small amount that's in this jar and in all of our topical power products, will not be detected in the urine. That's what we mean when we say it doesn't show up on drug screens. Okay, so it is 9 o'clock. I have an amazing Wakanna Medical Advisory Board. You guys are amazing. But I do want to unmute LaShawn because LaShawn, I think your guest has a question and I don't want to miss that question that your guest has. I'm sorry. You can unmute yourself, LaShawn. Thank you, Dr. Betty.
You know, I'll have to go, Dr. Rita, into the chat to see what she put in there. Just let me go in there.
Okay.
Hopefully you can still hear me.
Yes.
She said, I'm sold. I will be buying this cream from LaShawn, and if anyone wants to come to Forest Park for a massage, she will be using Wakanna products.
Oh, that would be me. I will be coming.
And she put 20% off for anybody who mentions this call.
Wow.
She just put that in 20% off. 20% off, and she's gonna buy the products off my website. So there you go.
Yeah, so can you put your address down there in Forest Park where you're located?
Really, because I live in Forest Park.
Dr. Betty lives in
Forest Park.
Your address.
Beautiful.
Absolutely.
Thank you, Dr. Rita.
You're welcome. LaShawn, oh, there it is. 7451 Madison, CBD Body Hive.
Yes. Yes.
And what is your address, Sandy Rose, for all of those that are in Columbia, Ohio?
We are so it's Replenish, right downtown in Columbus, Ohio, 124 South Washington Street. We are right behind the main library, right behind the park, at the main library in this beautiful Victorian home that you see behind me.
Fantastic.
Yes.
Well, let's give it up for Sandy Rose. You did an amazing job. Thank you so much for sharing. Thank you, my Wakanna Medical Advisory Board. You guys are amazing. All of the shares, all of the information, all of the very, very important attendees. Please get back to the person that invited you so you can get your questions answered, you can get your products ordered, and you can lock arms with us here at Wakanna. And we will see you next Wednesday night at 8 p.m. Central Standard Time. And have an amazing rest of your night. Thank you, everyone.
Bye, guys.
Great job. Great job.